All right, guys, let's answer the question. Is nursing case management stressful? Now, I know this question is on a lot of your guys' mind because you guys are thinking about going into nursing case management and you guys are afraid. You guys got all these questions in your mind and you don't know what to expect, okay? That's totally fine. I went through that phase before I got into nursing case management. I was like, is this going to be more stressful than being at the bedside, taking care of patients, providing direct patient care? All right, so you're not alone, but I'm here to answer that question for you. Can nursing case management be stressful? Not gonna lie, sometimes it could be stressful, okay? However, it's a different type of stress than the stress that you're dealing with at the bedside taking care of patients. Let me give you an example. For example, let's say I have a patient that's on my list that's being discharged from the hospital today and they need oxygen equipment before going home, okay? So the doctor puts in an order for the patient to have home oxygen. Then what I do as a nurse case manager is I get that order, I send it to a oxygen company vendor so that they can process the referral and make sure that and let me know whether they can provide the patient that I'm taking care of that's going to be discharged from the hospital with oxygen so that when they get home they have the oxygen that they need. Okay, so that's my job as a nurse case manager, but sometimes it doesn't always work that way. Sometimes I'll send the order to the oxygen vendor and they'll let me know, hey, today we can't process the referral, we won't be able to provide the oxygen to your patient for whatever reason. So then I have to go back to the doctor and tell him, hey, Dr. Lee, we're gonna have to cancel the patient discharge today since we can't secure oxygen for the patient today. And so sometimes the doctor will get upset and be like, what do you mean? The patient's medically stable to leave today. What do you mean they can't go? Why can't you get the oxygen? And so for some people, that would freak them out. But for me, as being a nurse case manager, that doesn't freak me out. I just be like, hey, you know what? We did the best we could. I sent them the paperwork that they need to the vendor, but they can't provide the patient with oxygen for whatever reason. So we'll just have to postpone discharge for another day, for tomorrow. And so sometimes, things like this will happen in nursing case management where things get delayed. And sometimes you'll have upset family members or upset patients because they want to go home that day, but things haven't been worked out, so they have to remain in the hospital for one night, and you just have to work on it the next day when the vendor or the agency can provide these services to the patient, because we don't want to send the patient home without oxygen and then they become short of breath at home and then they got to come back to the hospital. And then that'll look bad on you. So yeah, sometimes you get upset people with you, but as a nurse case manager, at least for me, that just rolls over my shoulder. That's fine. I mean, I know I did my job. Those things are out of my control. So, but yeah, that's just an example of some type of stress that you can deal with. And I'm totally fine dealing with that type of stress. I prefer dealing with this type of stress over the stress of, oh crap, I gave this patient too much morphine, or I pressed the morphine or the Lasix too quick because I got so many things to do on my plate. I got to take care of 5 patients on the med-surg floor, and that's a different type of stress. And not only that, but you can potentially kill a patient if you're not really focus and you're not taking your time with the things that you're doing when providing nursing patient care. My type of job, I cannot kill a patient. The worst thing that can happen is patients or the doctor will get upset with me, and that's fine. That's the worst thing that can happen. Or the patient will stay here 1 more night or 2 more nights in the hospital. That's fine. I can deal with that type of stress. Some people can't handle that type of stress. Some people prefer to be at the bedside, being coughed at in their face. You don't know what kind of infection this patient has. Maybe has COVID, maybe has TB, has uh, an infectious respiratory disease, and you're putting yourself at risk, and that's a different type of stress that I prefer not to deal with. That's a beautiful thing about nursing, is that there's a place for every nurse. Some nurses really love being at the bedside providing patient care. That's awesome. I'm not that type of nurse. Even though I'm good at it, I prefer to be on the non-clinical side of things, where I'm working from an office, managing patient care, coordinating patient care, managing the paperwork, talking to other facilities, being in meetings with members of the interdisciplinary team. That's the type of work that I prefer to be in. I get to dress up in nice clothes. I go into the hospital clean. I leave the hospital clean, and it's nice. I prefer that type of setting for myself. Like I said, not everybody thinks the same as me. So yeah, nursing case management has some stressful days where there's a lot of things going on, but you have to remember you're only one person, so just do the best you can. And if people get upset, that's on them. But as long as you know that you did the best you can, and you are being as productive as possible, that's all that matters. You're not putting a patient's life or health at risk. Worst case scenario, the patient doesn't discharge that day. Worst case scenario, you can't find a home health agency for the patient. You just got to continue looking for an agency tomorrow, the next day. These things can be fixed. So yeah, nursing case management does have some stressful days, because sometimes there are a lot of patients you have to manage at once, but it's non-clinical, so you're not putting the patient at harm or at risk. Nobody's going to die because you couldn't fax a specific form to an agency on time. Nobody's going to die because a skilled nursing facility doesn't have a bed for that patient today, or they couldn't get authorization for them to be admitted into the skilled nursing facility. So, things like this happen. There's going to be hiccups, but don't worry. Stay calm, stay relaxed, stay composed, because you can work on these things the next day. It's all about how you communicate with members of the interdisciplinary team, explain to them what's going on, and that you tried your best. All right, guys? So I hope that answered your guys' question. Also, another thing that I want to mention is that nursing case management will be a great fit for you if you're a great communicator, if you're an organized person, if you know how to plan out your day. Once you clock into your shift, you look at your patients, you know how to prioritize, and you know how to communicate well on the phone, communicate well with the doctors and the nurses, and the physical therapists and the family members and the patients. So I think it'll be a good fit for you if you're a good communicator, if you're assertive, you don't let people walk on you as well. You gotta remember that you're in a leadership position, and so you need to carry yourself as a leader. So yeah, guys, I hope this video helped. Don't forget to like and subscribe to this channel. Love you guys.